For 3 months from Christmas leading up until about March, I was very weak. Progressively, I was losing weight, very tired, and there was no obvious reason for this.
I was really underweight because I've got a lot of gastric issues. So I only weighed about 47 kilograms, and in 3 months my weight doubled to 95 kilograms. I had lots of other symptoms sort of looking back as well.
Tiredness is one of those things you say to anybody, they say, well, I'm tired. I'm like, I'm not sure that you feel exactly how I feel on the level of tired. I don't think mine's everyday life, normal, acceptable tired, I think. But then you think maybe I'm just entirely wrong and I need to suck it up and there's nothing happening. So being told that there was something, it was just, I burst into tears with happiness.
I was diagnosed 31 years ago with Cushing's. I had my pituitary tumour removed. That wasn't the source of my Cushing's. I subsequently had my adrenal glands removed. The source was actually found 20 years later in my appendix.
My GP referred me to an oncologist. So I saw the oncologist. The oncologist could see that I didn't have cancer, but he remembered his 3 minutes of medical training on Addison's disease, which I think is about as long as they get. And he sent me for a couple of tests, cortisol, sodium, potassium levels and so on. And then phoned me the next day with a diagnosis saying, I think I know what you've got. You need to get into hospital quickly. You'll be taking tablets for the rest of your life, but it's something which is treatable. And you're in good company. JFK had it as well. That was the story of my diagnosis.
Cushing syndrome affects an estimated 10 to 15 people per million worldwide every year. Cushing syndrome most commonly affects adults aged between 20 and 50 and is most prevalent in women, accounting for about 70% of all cases. About 8,400 people in the UK have Addison's disease. It can affect people of any age, although it is most common between the ages of 30 and 50. Again, it is more common in women than men. The hypothalamus is a region of the brain that controls an immense number of bodily functions. It is located in the middle of the base of the brain. The hypothalamic pituitary adrenal axis, or HPA axis, integrates physical and psychosocial influences in order to allow an organism to adapt effectively to its environment. This includes the fight or flight response. The hypothalamus contains a number of small nuclei. The paraventricular nucleus, or PVN, is a nucleus that contains a group of neurons. When you experience stress, the PVN is stimulated. It then releases CRH and AVP, which are transported to the pituitary gland. There, it stimulates the secretion of stored ACTH. The ACTH is then transported by the blood to the adrenal gland, where it stimulates the synthesis of cortisol. Cortisol is released into the bloodstream, which increases the availability of glucose in the body in order to cope with stress. Once in the system, cortisol travels back to the hypothalamus and pituitary gland, where it inhibits the secretion of CRH, AVP, and ACTH. In this way, it limits the production of further cortisol, which over time results in the cortisol level dropping, allowing the system to start over again. It is this process that creates the oscillations of cortisol and ACTH in your system throughout the day. Addison's disease and Cushing syndrome are opposite sides of the same coin. Both Addison's and Cushing's are dysfunctions of the HPA axis. Cushing syndrome is a hormonal disorder resulting from too much cortisol in the body. This is sometimes called hypercortisolism. In Addison's disease, also known as adrenal insufficiency, the adrenal glands do not produce enough cortisol. This can be due to a number of factors, including a damaged adrenal gland or a deficiency of the hormone ACTH. Among its many vital tasks, cortisol helps to maintain blood pressure and cardiovascular function, reduce the immune system's inflammatory response, maintain levels of glucose, a form of sugar used for energy in blood, and regulate the metabolism of proteins, carbohydrates, and fats. These, along with many other functions, make cortisol a crucial ingredient for overall health and well-being.
I'm Professor Lightman. I'm Professor of Medicine at the University of Bristol. I'm a neuroscientist and an endocrinologist. So hormone dynamics refers to the fact that the levels of hormones in your blood vary during the day. So for instance, cortisol, which is an extremely important hormone for the body, is an anticipatory hormone which needs to be raised before your body actually needs this activity. So it goes up before you wake up in the morning, so that when you wake up in the morning you've got high levels already and you're ready for all the activities in the day. Also during the day it varies in pulses throughout the day, so it oscillates up and down during the day, and this gives your body the best way of reading the message from that particular hormone, so it means that your body tissues responding in the best possible way to the cortisol. One of the first things that happens in Cushing's is your daytime levels of cortisol remain quite normal, but actually it's the levels at night go up. So you get increased levels of cortisol at night. It's a time when your body usually has a holiday away from having any cortisol. In Addison's disease, the problem is somewhat the other way around. Patients don't produce any cortisol. And when we give it back, we give them back by tablets. Well, when you give tablets, it gives very smooth levels of cortisol during the day because you absorb it, it goes through your stomach, it goes into your blood, it doesn't oscillate. And this means that your brain, your metabolic tissues and your immune tissues aren't responding as they should to the cortisol.
I'm John Terry. I'm a Professor of Biomedical Modelling here at the University of Exeter, based in the Living Systems Institute. I'm also Director of the EPSRC Centre for Predictive Modelling in Healthcare. So the centre basically aims to develop and apply mathematical models for helping us to understand healthy physiological function, and in particular how these physiological processes break down and lead to disease. So mathematics, and in particular what we term differential equations, describe how processes change over time. So as we mentioned earlier, hormone dynamics change over time with different scales. So for example, the hourly rhythm or the circadian rhythm over the day. A mathematical model can help us make those dynamics specific to an individual, and in the context of healthcare, that could be really important because the profile of your hormone dynamics may be very different to mine, but if we gave the same treatment to both of us, it could have very different effects.
Mathematicians at the University of Exeter are working alongside clinicians and people with steroid-dependent medical conditions to raise awareness of the importance of cortisol dynamics in health and disease. This work hopes to demonstrate how mathematics can help us understand these dynamics, allowing us to identify priority areas for future research.
It's been very useful. I have actually learned, even having been diagnosed 15 years ago, I have learned something more about Addison's, about the research that is currently being carried out or planned, and it's given me an opportunity to talk to other people with Addison's and compare notes.
I think today was really good to start having those conversations between researchers and patients. Personally, for me, I think it could be really revolutionary to treatment.
I think the reason why we're helpful to the researchers is because we live it and they don't, so we definitely could be more involved. I think that getting our community on board with whatever research will actually be very easy. We'll all just be like, I want to try this, I want to make this better, I want to improve this, anything we can do.
I think it's brilliant. I think it's very useful, and I think the more that patients are involved, the better outcome it will be for the future.
We are many voices. I think these kind of collaborations where you have patients and members of the medical profession working together, involving us in research, is the way forward.